should I do lipo? Is it going to actually help me lose weight? What's going to happen after? And I would love to hear your thoughts on lipo because it's not actually used for weight loss.
No, it shouldn't be. And it's funny because I get patients come in with all different ideas. I had a guy come in to see me a couple years ago, and he was funny. He was probably in his mid-50s, and he comes and sits down. He has a huge pot belly. And I go, well, hey, what, I'm like, oh, John, I'll just say his name, John. What can I do for you? What would you like to talk about? I swear to God, this is literally what I said. He goes, I need to get rid of this blubber. And he starts grabbing his tummy. This is all visceral fat, So first of all, liposuction cannot get rid of visceral fat. And so visceral fat is that fat on the inside of our abdomen, around our inner organs and all of that. And that causes the tummy to look rounder like a lot of, some men get. Liposuction, you are limited in general with how much you can liposuction safely.
Isn't it 5 liters?
Exactly. So the FDA recommends limiting liposuction to 5 liters in one setting unless you have blood products available and or you're doing this in a hospital.
Right.
And the reason why is because you lose so much blood that and who wants to undergo liposuction? They get a blood transfusion afterwards. Like, this is just not the right thing. So how much is 5 liters of fat? Well, not all of that 5 liters is true fat. Right. You're talking maybe 60 or 70% of it at the most. So you're literally looking at taking off maybe 10 pounds. And now you're talking about a 4-hour huge operation where you're going to lose 10 pounds and you're going to have weeks of recovery. Like, it's not an easy way to lose weight. Ideally, liposuction is best done if you've got stubborn areas of fat that just won't go away. And you and I know, that people inherit fat depositions. Like, if your mom has a double chin, you're likely to get a double chin. If your mom has saddlebags, fat on the outer thighs, like you're likely to inherit it. If your dad has a pot belly, you're likely to inherit that.
Meaning because of the aging, if you do nothing, the natural aging process or just the deposition of body fat?
I think genetically, our bodies are predetermined to hold fat in certain areas. Now, you can lipo some of that fat away, okay, and that will make that go away. But I think those are also areas of fat that are the hardest to get rid of, So once again, I have patients of mine who are real thin, but they have a double chin, and their mom has the same thing. No matter how thin they get, that fat just doesn't go away sometimes for them because it's genetically predetermined. Like sometimes that type of fat is the last fat to go.
If it ever goes. Right?
Exactly.
If it ever goes.
And I see it even with people, and I get myself, under eye fat, this puffiness under your eyes, that runs in families too. That is fat inside your eye socket that's protruding. I've seen patients of mine who are in their 30s who have that. Their parents have had it. And then they have kids that come in who are like 12 or 13 and they've got puffy under eyes. We inherit fat deposition from our parents. Yes, with plastic surgery, you can treat that, but it's still going to be in your genes,
But that would be the way. So if you're saying basically if they have, it's spot reduction.
Exactly.
It's only spot reduction. It's not really about, again, the most you would ever be able to take would be 10 pounds max. And then you have to think about bilaterally, right? If it's both sides.
It's ideally best done in somebody who's at a healthy, reasonable body weight. And they go, you know what, no matter what I do, I've just got extra fat on my arms and my mom has it too, or my dad has it too. Those are really and that's going to be most, I think, beneficial overall because once again, there are those areas of fat that, people used to believe that, if you've got fat over your arm, you just do a lot of triceps exercise. That'll make that fat go away.
It doesn't go away?
No, as we know, you can't spot reduce fat by working out. And so, but there's still that belief I think that people have. I get so many patients who come to see me and they've got, a little bit of extra fat or skin in their tummy after having children and their husbands, boyfriends tell them, just do more sit-ups. You're not doing enough sit-ups. And it's like, come on, like that doesn't work that way.
Get out of here, dude. Get out of here. What happens so you remove these fat cells? Do they ever come back? Do they ever proliferate back?
No, but the fat that's still there, because you can't remove every fat cell, can enlarge. So there is a belief on the minority that if you remove fat from one part of the body, that you will gain it in another area. There was a small study that came out like 12 years ago that appeared to show that, but since then there have been multiple other studies, much larger ones, that have disproven it. I've been doing liposuction for 20 years. I have never had a patient come to see me and they're like, yeah, you took fat out of my thighs and now I've got Popeye arms. That
it doesn't happen.
In 20 years, I've never had that. Now people can gain weight afterwards and fat can come back.
Does it usually redistribute back to those places?
Not necessarily. And the hope that, and what I try to explain to patients, the ideal is that you give them the shape that they're looking for. You take down those stubborn areas, and then if they do gain weight, they gain weight proportionally with their body. So it's no longer sticking out, because now those fat cells are less in number. They may still increase in size, but maybe there's half of what there was before.
And is it very invasive, or is it a pretty...
Lipo?
Yeah.
Yeah, it's invasive. So you make an incision, which it's a small scar, which is good. Then we inject a bunch of anesthetic fluid into the area. We call it tumescent, and that has lidocaine for pain and epinephrine to help constrict blood vessels. That was one of the issues with lipo in the past, was that the first type of lipo is you just make an incision, you just start sucking out fat, but they would just bleed like crazy.
Right.
So the epinephrine helps to reduce the bleeding. And then after that, you put literally 1 or 2 stitches in the incision. Then they have to wear tight garments afterwards. Usually the patients drain for several days, where they're just draining, seeping fluid. And it's sore. You know, it's not like sharp incision sore, but it's like somebody beat me up type sore. Not that I've ever been beat up before, but that's
We could change that. Where's Shane? No, just kidding. Matthew, you up for it? In terms of the increased use of Ozempic, are you seeing that liposuction, do you have an idea if it may become less popular because the non-invasive utilization?
You know, when I started my practice in 2004, we were seeing a lot more like full body lipos. I don't see hardly any of them anymore, honestly. And I don't know if it's just my practice.
Maybe you've already cleaned up everybody in Michigan.
Well, and part of it is that, like, you know, somebody comes in and they're overweight, like I try to encourage them, hey, you know, work on lifestyle stuff first. It used to be when I was more of a cut first surgeon. Yeah, I'd bring patients back and we do 4 liters of lipo, like a liter off each thigh, you know, half a liter from the front of the tummy, half a liter from the back, and then we do the arms, stuff like that. I almost never see that anymore. But that's also my practice, is maybe it has evolved. But I do think there's so many people on Ozempic nowadays.
Yeah. Which I think could be really, really great, Ozempic or Mounjaro, especially if you're doing the right things.